Human nature is relentless. It needs to keep moving, running, thriving. The past decades of human life have been a continuous, accelerating sprint, but in 2020 all of this came to a stop.
Chinese health authorities are still working to identify the virus.
At least 59 people are believed to have been sickened by the new virus.
The coronavirus presents a public health emergency in the United States.
COVID-19 can be characterized as a pandemic.
Among all European countries, Italy was the first to witness how quickly the virus could spread. Starting from the small town of Codogno, COVID-19 found its way across the nation, but it was undeniable that Lombardy was the region that suffered the most. Therefore, it's natural to ask, why Lombardy? To compare Lombardy with other European regions, two main topics are worthy of investigation: pre-existing factors that may have influenced the spread of the virus, and the policies implemented to limit the pandemic. For the contributing factors, we retrieved data regarding 6 topics: education, population, economy, primary sector, healthcare system, and mobility. All data presented a notch to granularity, the European standard to divide geographical areas. We took the density of COVID-19 cases during the second wave as the target for a classification model to divide European regions in high and low risk areas. The resulting comparison of the contributing factors revealed some interesting correlations. High numbers of hours worked, as well as high numbers of students enrolled in education, proved to be correlated to the spread of the virus. And since COVID-19 tends to cause more severe consequences in older populations, regions with high life expectancy were also more hit by the virus. We also analysed the regulations implemented in Europe during the first wave. The regulations concern several types of non-pharmacological interventions employed with temporal and geographical differences. Thanks to a descriptive analysis, 3 types of regulations proved to be the most efficient: regulation of businesses, internal border restrictions, and lockdown legislations. Now more than ever, it is crucial to share reliable information to allow both public institutions and private citizens to know more about the pandemic. This is why we created an open source platform not only to discover the results of our research, but also to freely navigate and download the data. COVID at Lombardy, together with its partner institutions, wants to be part of the wide academic landscape whose aim is to improve our health, inform global citizens, and protect our well-being, even in a difficult fight like the one against COVID. So click, scroll, and share to help us spread the knowledge, not the virus.